Assessment of skills. So this video explains you about the evaluative tools used in assessing the skills of nursing students. Knowledge is tested by theory examinations, whereas the practical examinations helps in assessing the students' skills. Though this teacher should focus on combination of these tools, which makes it effective for an holistic, comprehensive skill assessment. The methods used in assessing skills are traditional or conventional practical examinations, observational checklists, anecdotal records, OSCE or OSPE. We will discuss one by one. Practical examinations. The traditional method or conventional method of practical examination focus on the practical laboratories or real life practice areas, so that it covers all the 4 domains of the education, that includes knowledge, attitude, IPR, that is interpersonal communication and relationship, and the skills. What are the purposes of practical examination? It includes assessing the practical skills and competencies for the nursing students based on their year. Assess the students' response to real life experience. Assess the student's problem solving skill and the skill of transforming theoretical knowledge to the practice. What are the phases or guidelines in traditional practical examination? So as a teacher, when you conduct practical examination, what are all the things you should go through? So there it includes 2 phases. One is planning phase, the other one is conducting phase. So the planning phase includes the following steps. The first thing what you should do is consider the learning objective. For every educational tool or evaluative tool, you should understand the objective of your students and objective of the educational or learning experience. Decide appropriate place. So you should select a place according to the learning objective. For example, if you are conducting a pediatric examination, so you should select an appropriate place where the children are admitted with the problems, so like a child health hospitals. Plan for a familiar place. So here what you should do, you should conduct the examination in a place where the students are experienced or exposed in their practice. For example, if you are conducting a psychiatric practical examination, you should send the patient for examination to the place where they have gone for an experience. So you should select a place appropriate as well as the student's exposure is there. Arrange for adequate supply. So you should make sure of the articles, equipment and resources and resource persons needed for practical examination. Take prior permission. You should take a permission before the examination from the authority. Prepare evaluation criteria. So as per the practical skills what you are planning to conduct, you should prepare an evaluation criteria for each and every aspect of the test you are going to conduct. While conducting phase, reach the area as per the schedule and convey rules and regulation to the students. So once the students are there, you should clearly explain them what they are going to do during the time of examination. Assign patients randomly. So when you assign the patients to students, mostly we use a lot method. So you can put the name of the patients and make a lot and ask the students to randomly select their own patients. Provide sufficient time to perform and follow confidentiality when you do an evaluation. Don't expose it to students or other faculties. Score with the evaluation criteria. So when you score also, you should use a standardized technique by using an evaluation criteria what you prepared in the planning phase. Try to avoid bias. What is the advantage of practical examination? It provides opportunity to assess the skills and competency. If you want to know the competency of any practical skill in nursing students, the best method is practical examination. Opportunity for examiners to assess the holistic performance. So when you do a practical examination, you won't look for only the competency, but you will look overall attitude and communication skill and the knowledge, everything. Assessing communication and IPR skills. So this live practical examination helps in assessing the communication and interpersonal relationship skill of the students. This won't be possible in the simulated experience, but in real life experiences, this is very, very effective. What are all the disadvantages? Though it has lot of advantages, but there are some disadvantages. First one is time consuming. So if you conduct practical examination for every student, of course it takes lot of time in preparation phase as well as in conducting phase. Not feasible for large group, as it takes so much of time. It is not feasible for a very large number of group. Otherwise you need to divide them into so many small groups and you will conduct. Sometimes disturbances created in ward may affect the smooth conduction of examination. So while there is practical examination is happening, during that time there may be some emergencies happens in the ward which is unavoidable, which may affect the smooth conduction of the examination. For example, a patient may go into crash, or some emergency things happens in the ward will disturb the smooth functioning. Personal bias may happen from the evaluator's side. Lack of standardized assessment. Though there is evaluation criteria, but sometimes if it is not well designed or nicely created, it may affect the standardized assessment. The next one is observational checklist. So when we conduct practical examination, when you are going to assess the student's skill, the best method is observational checklist. A checklist consists of a listing of steps, activities or behavior with the observer records when an incident occurs. So when a student is doing a skill, so the examiner can have a skill list which can be checked simultaneously when the student is doing it. A checklist enables the observer to note only whether or not a trait or characteristic is present. So what the observer should do is, from the checklist, whatever has been said, whether the student is doing or not. So that can be checked with the help of observational checklist. So whenever the examiner is going as an observer, he can have a checklist as per the skill the student is going to do, so that it can be easily assessed. So what is the guidelines used in checklist? The checklist should be directly related to learning objectives. So what is the objective as per that the checklist has to be created? It needs to be confined to performance areas that can be assessed by positive and negative criteria. So it should be as per the performance areas can be tested with the checklist. So knowledge cannot be tested with the checklist, whereas the skills can be tested by a observational checklist. Use checklist when ascertaining a trait or characteristic is present or absent. So when you use a checklist, you should say whether this is done or not done, yes or no, so that present or absent. So those kind of checklists should be prepared. Clearly specify the traits to be observed. So what are all the things you are going to observe? It should be clearly listed down. For example, in case of hand hygiene or hand washing technique, so every step in the hand washing technique has to be listed in the checklist, so that you can assess the student's complete skill. Have a separate checklist for each candidate. So when you use an observational checklist, the best method is you can use a separate checklist for each student. Multiple observations provide a more accurate assessment. So if the checklist is used once or twice, then the assessment will be more accurate. So instead of one single observation, you can make multiple observations. Students should be evaluated in natural settings. So this the observational checklist is used when the students are in a natural setting. So this is an example of an checklist pattern, how you have to prepare it. Student classroom behavior observation scale. This is a sample of the observational checklist. So you can list down the things whatever comes under a skill, and you can divide it, either you can grade it like 1 2 3 4 5 6, how many times. In that cases you can do it like this. This is a repeated observation. That's why they have put like 1, 2, 3, 4, 5. Like every 2 minutes they have made one column. So if you are going to conduct one time checklist, you can make one column. The next one is anecdotal record. So when during observation, and if you find any problems from the students, then you can use an anecdotal records. So it is a brief description of an observed behavior that appears significant for evaluation purpose. So you are observing the student and you find something to be explained or something to be described, so you can use an anecdotal records. An objective description by the teacher of a significant occurrence or an episode in life of the student. So anecdotal records is maintained by the teacher for the whole year and it will be handed over to the next year teachers. So all the positive and negative aspect of a student will be recorded here, and what has been, and it will explain the complete situation as well. So what is the characteristics of an anecdotal record? A factual description of an event. So if there is an event happening from a student's life, what happened? You should write how it occurred, when it occurred, under what circumstances, and what is the treatment or method you have advised for the student. So anecdotal record should include all these criteria, like how, when, and under what circumstance, and what has been taken, action taken. So what is the purpose here? To stimulate teachers to look for information, that is to help student in self-adjustment. So if you want the teacher to look for information, for example, the second year students are new to me, so I want to see how the students' behavior is. I can look into their anecdotal record, and also it will be shown to the students for their self-adjustment as well as self-assessment. The teacher is able to understand her pupil in realistic manner. So you can understand your own students with the help of this anecdotal record. It provides healthy pupil-teacher relationship. So when you maintain an anecdotal record, the teacher will understand the student as well as the student will accept how the teacher is evaluating and what is the action taken. Everything is recorded. So she will have a belief and a good relationship. Helps the student to improve their behavior as it is a direct feedback of an entire observed incident. So one incident happens, it is not a blaming issue here. You will be explaining the student why it has happened, how it has happened, and what is the rectification done or how the problem is solved. So it helps the student in improving their behavior. Can be used by students for self-appraisal and peer assessment. So even the students themselves can have a assessment by looking into the anecdotal records. Principles. So when you use an anecdotal record, what are the principles you should follow? Concentrate on only one or two behavior observations, not more than that. Record should be complete. They should be kept by all teacher and not only by the student teacher. It's not only for one teacher, it should be kept for all subject teachers. Record the incident or action as soon as possible, because we may forget the detailing of the incident once it is delayed. So you should record it immediately. The teacher should have practice and training in making observation and writing. So this kind of practice should be made by the teachers. So this is an example of an anecdotal record where it explains observer, student, observation date and time, what is the incident, where is the location, and what is the suggestion made, and the teacher's signature. So provision, what is the advantage? Provision insight into total behavioral incidents, use of formative feedback, economical and easy to develop. So it helps in, it is easy, just a notebook or something can be used as an anecdotal record, and it is it gives a formative feedback during the course, and it gives an insight behavioral incidents. But there are disadvantages. If the record is not proper, then it won't be a sufficient information. Subjectivity happens, bias may happen, a lack of standardization, everyone follow a different kind of method writing, difficulty in scoring, and time consuming. So we have discussed practical examinations, observational checklist, and anecdotal records. In the next class, we will discuss about OSCE and OSPE. Thank you.